Apps and digital tools are routinely becoming part of the way health and social care professionals and patients communicate and manage all aspects of our professional and personal lives, including health and well-being. Digital mental health technologies include products such as websites, apps, and virtual reality software. They can play a role in supporting a person's mental health, and it's important to know how these products are regulated and how you can select an appropriate product for yourself. Not all digital technologies are medical devices, but for those that are, they will have been through the CE or UKCA certification process. And whilst conformity with this should be clearly stated, you may need to check through the website or app to locate this. This means that it has been assessed to meet criteria relating to medical device regulations in the UK. To understand whether the digital technology is right for you, you might want to check how and with whom the product was created, and whether there is any supporting evidence for who it has been tested on and how effective it was for this group of people. To do this, you may want to look for links to published research and see whether this reflects the kind of experiences that relate to you and your symptoms. Research papers should summarise how the trials were undertaken, with whom, and what the results were in a format you understand. If you select a digital technology that is CE or UKCA accredited, and you feel that it has caused your symptoms to unexpectedly worsen, or has had an undesired or negative effect on you that was not made clear in the instructions for using the product, you can report these as suspected adverse events to the Medicines and Healthcare Products Regulatory Agency, more commonly known as the MHRA, via the Yellow Card scheme. The MHRA is the UK regulator for medicines and medical devices, including software as a medical device. They oversee the safety of these products and can intervene if a trend of adverse events, known as safety signals, are detected. The Yellow Card scheme is just one source of data the MHRA uses to identify the occurrence of adverse events. Your report will contribute to the signal detection process and will be duly acted upon if a concerning trend is detected. Digital mental health technologies should provide an alternative resource to manage your mental health needs, and many people find them helpful. Regardless of whether or not you have reported to the MHRA, you should always contact a healthcare professional if you are concerned about your mental health. For more information on medical device regulation, visit www.gov.uk/MHRA.